In Western culture, wisdom teeth are the common name given to the third and last set of molars in your mouth. This nickname was given because they are the last teeth to erupt, with an average time frame typically between 17 and 25 years old. Most people commonly have 4 wisdom teeth, 2 on the top and 2 on the bottom, to complete an adult set of 32 teeth. In today's speech, we will start off by covering what wisdom teeth are and indications to have them removed. Next, we will look at how wisdom teeth are extracted. And lastly, we will discuss aftercare and common complications. Before we look at reasons that wisdom teeth are removed, it is important to understand what they are and reasons to have them removed. Wisdom teeth are the last teeth to erupt in the mouth. Because they are the last to erupt, the decision to keep them or remove them is dependent on the amount of space in your mouth. They can erupt as early as 15 to 16 years old, but depends on each person. Typically, women will develop these teeth earlier than men. A reason to have your wisdom teeth removed is impaction. Impaction is when wisdom teeth is blocked by another tooth, or it grows in a way that makes it impossible to enter the mouth normally. If you turn to my visual aid that I had attached, you can see the different types of impaction. Impacted teeth can grow in horizontally facing the tooth, angularly toward or away from the tooth, or vertically. Other reasons to have them removed can be from pain, cavity on the tooth, infection, inflammation, or potential damage to adjacent teeth. Now that we understand what they are, we will transition to the procedure. There are 2 main ways that they are extracted. They are extracted through simple extraction and surgical extraction. The first way is simple extraction. If the tooth is erupted and there are no issues getting to it, a dentist may extract it as a whole tooth. After the tooth is extracted, it is flushed with the area is flushed with saline, and gauze is placed on the area for the patient to bite down on. This extraction does not typically require any sutures. The second way is through surgical extraction. The type of impaction can change the type of extraction or the way the extraction is done. But an incision is made and gums are retracted to expose the tooth. The dentist may use a burr to cut it up and extract the tooth by sections. Following the extraction, the area will again be rinsed with saline, and the dentist may place sutures and have you return for a follow-up visit. After the extraction, there are a few aftercare instructions to follow. After surgery or before surgery, your dentist and their staff will go over verbal and written instructions with you. Important aftercare instructions include gargling with warm salt water, biting down on the gauze, no sucking through straws or negative pressure, no carbonated drinks, and staying away from smoking. Additional aftercare instructions include monitoring the sutures, taking medication if medication is prescribed, and taking it as prescribed, and getting plenty of rest. It is important to follow the aftercare instructions to avoid complications. Some common complications can include dry socket, which can be triggered by smoking, permanent numbness in lips, tongue, or chin, and other complications can include excessive bleeding, pain, slow healing, and sutures may fall out earlier than expected. In conclusion, in this speech we discussed what wisdom teeth are and reasons to have them removed. Then we discussed simple and surgical extractions of the wisdom teeth. And lastly, we reviewed aftercare and common complications. Although many people get their wisdom teeth removed, it is not necessary. Annual trips to the dentist is highly suggested to properly monitor and update changes to your teeth. This can prevent emergency dental visits and costly procedures.